let's look at one final way that prioritization questions are formatted. And you don't see this type of formatting as often, but there's a chance you can see these. So I wanted to go ahead and throw it in so you're not shocked if you see something like this on the exam. So it says the nurse is caring for admitted clients involved in a mass casualty incident. The nurse must discharge a client to make a bed available for more injured clients. It would be most appropriate for the nurse to recommend discharging which client. So if we are planning on sending somebody home, we need to find the client that is least sick, or basically the lowest priority. So we're kind of working backwards. So our options are a contusion to the chest wall with a heart rate of 110, soot around the nose and mouth and a respiratory rate of 30, a headache and bruising behind the ear following a head injury, and superficial non-bleeding abrasions to the face and upper extremities. So let's take a closer look. So I see already a lot of people are making some guesses, but pay close attention even if you think you know the right answer with this one. I chose this question for a reason. There is a lot of super high yield conditions we're about to talk about that you want to be able to recognize whenever you go to take the exam. So the first one, you have a contusion or bruising to the chest wall with a heart rate of 110. So we know that heart rate's a little bit elevated, so they are a little tachycardic and there's bruising. So what do you guys think? If y'all are working in the emergency room and you have a client that comes in with bruising to the chest wall and they're a little bit tachycardic, what are you worried about? Any specific condition come to mind? So I'm worried about cardiac tamponade, okay? So if y'all remember that, there's that pericardial sac around the heart and it can fill up with fluid. And that heart can't pump as efficiently and you start seeing decreased cardiac output. So you're gonna start seeing changes in the blood pressure. You're gonna start seeing tachycardia. So the point to all that is, do we think that if a client has bruising of the chest wall and tachycardia, they are stable to go home? No. So that's going to be probably like a circulatory issue. And some people, Irene, also you said pneumothorax, and that's, it could also be pneumothorax anytime you have chest trauma. And so even still, that's a breathing issue. So either way, I don't want to send them home. And then option 2, this one I want you to pay close attention to these keywords: soot around the nose and mouth, and respiratory rate of 30, which we know is a little elevated, so they're a little tachypneic. But anytime you see soot around the nose or mouth, or someone is coughing up sputum and there is soot in there, that means that they have breathed in smoke. So we are concerned about an inhalation injury. Now this is very life-threatening, okay? A lot of times in the ER, which is where I worked for most of my nursing career, if somebody has an inhalation injury and they have any type of symptoms such as this increased respiratory rate, we go ahead and intubate them. The reason this is so dangerous is smoke is an irritant to the airway. And so as the airway gets irritated, it gets more and more inflamed. And before you know it, that patient can't breathe, but we also can't really stick an endotracheal tube down there because of all the swelling. So anytime you see soot around the nose or mouth or in the sputum, that is an indicator of a life-threatening condition and very high priority. So once again, it's airway or breathing, we are not sending them home. And then a headache and bruising behind the ear following a head injury. So any bruising behind the ear, that has a name, battle sign, okay? Does anybody remember what injury that is usually associated with? If we see battle sign or bruising behind the ear, is there a specific injury we need to be worried about? It's going to be a basilar skull fracture, and that's also a life-threatening condition that can cause changes in intracranial pressure, that type of thing. So it could be a circulatory or a neurologic issue. Either way, they're all pretty high priorities on this pyramid. We don't want to send them home. And then I know y'all loved 4. And so we have superficial non-bleeding, keyword non-bleeding, abrasions to the face and upper extremity. So that is a stable client, and that person, I would feel safe sending them home. We got it correct again.